Hey, welcome to the show. It's an important week in this country's fight against the coronavirus. A COVID-19 vaccine could be approved by Health Canada in just a number of days. And BioNTech, who's making that vaccine with Pfizer, told me in the last hour they expect to start shipping doses to Canada within 24 hours of approval. So there's an even bigger push to try and get more details from the federal government on how this country will distribute those shots, when Canadians might be able to roll up their sleeves. Also happening this week is a looming showdown between the Prime Minister and premiers as they demand answers of their own on whether they'll get billions more for the healthcare system. The minister at the centre of all those discussions is Dominic LeBlanc. He's the Minister of Intergovernmental Affairs and also chair of the Federal Cabinet Committee on COVID-19 and its response. Nice to see you, Minister.
Good morning, Rosemary.
So, as you know, this week there's been, I think it's fair to say, some frustration from certain premiers around information connected to vaccine rollout. Premier Doug Ford saying that incompetence and dishonesty are the reasons for the lack of clarity. Manitoba Premier Brian Pallister saying that Manitobans will be waiting longer than other provinces. So clearly there's some frustration. Do you understand that frustration? Are they not getting all the information they need?
From our perspective, Rosemary, the planning exercise in terms of an efficient vaccine rollout has been underway for many months. There have been 29 meetings with provinces and territories since May to talk about the logistics of a vaccine rollout. Just last week, Major General Fortin led an exercise with over 150 people from all 10 provinces and 3 territories into detailed planning of what the vaccine rollout will look like, including the first vaccine likely to be approved is the Pfizer one. And as you may know, it requires a very cold storage, minus 75 degrees Celsius. It's technically the most complicated. So that was the focus of the exercise last week. So from our perspective, the provinces have been involved from the beginning in the logistics and the planning of the vaccine rollout. And most importantly, we'll ramp that up and continue to include them because we recognize that this is a huge priority for Canadians, and we're very confident that it will go very well.
So what do you think that's about then, that rhetoric that we're hearing from certain premiers? If you're telling me that they're part of talks and part of the planning, what is that about then?
Rosemary, I can't pretend to speak for why the premiers would say something or not say something. I understand, and we understand, the Government of Canada understands, the importance that Canadians attach to an effective, safe rollout of the vaccine. Canadians are understandably anxious, we hope, to get the vaccine once Health Canada approves. And I think it's important to note that Health Canada has not yet approved as safe and effective any of the vaccines. Neither has the U.S. Food and Drug Administration. We expect those approvals to come shortly. So it's very much on track, Rosemary, and we're going to work with the provinces and territories in spite of what they might say publicly. We're going to continue to work very effectively with them because that's what Canadians rightfully expect us to do.
The provinces were told at the end of last week that they should have their sites ready by December 14th. What is the federal government doing to help them do that, just to deal with some of the complications around the cold chain, for instance?
And very good question. So again, the Canadian Government Operations Centre, where Major General Fortin is now working, will conduct on the week of December 14th sort of a practice run, a dry run, if you will, with all 10 provinces, including literally, receiving the Pfizer vaccine at minus 75 degrees, safely handling the dry ice that's required, right up to, planning to inject it into the arms of Canadians. So that exercise will take place. It's important from our perspective that every province be ready in terms of the very complicated handling of this first vaccine. Mm-hmm. As we said, we expect the Pfizer one to be the first. Moderna, we hope, will follow very soon thereafter. As you may note, we've ordered another 20 million doses of Moderna last week. So we're very much on track in terms of a procurement exercise to have access to tens of millions of these vaccines starting in January, but rolling right through the first part of 2021. And that's why it's essential that these practice runs be undertaken with provinces and territories, just so that any glitches can be worked out. And Rosemary, your question is, what will the government be able to do? The Canadian Armed Forces, amongst other federal agencies, will be very much there to supplement particular needs that provinces may have, backstop them in the case of some organizational hiccup. The armed forces will really be ready to help them with redundancy planning. So we want to be very much part of this successful rollout.
I know that provinces and you guys are still trying to figure out the distribution, whether it be per capita or on an epidemiological basis. Newfoundland, for instance, Dr. Fury told me last week that he wants it to be per capita. Manitoba believes that per capita will hurt its province. Where are you leaning so far on that right now?
So those conversations are ongoing. The provincial and territorial health ministers had a discussion on Friday last week with my colleague Patty Hajdu, the federal minister of health. Many provinces have advocated for a per capita sharing of the vaccines, but those will be finalized, we hope, in the conversations that the prime minister will have with premiers this coming week. There's no doubt, Rosemary, that a shared sense of a priority list as determined by scientific experts, by medical experts, helps provinces and territories in terms of identifying priority populations. But at the end of the day, the provinces and territories will be responsible for determining the priority populations in their jurisdiction. And the Government of Canada will obviously be handling the procurement and the delivery of these vaccines to the provinces where appropriate.
I'm glad you brought up Thursday because, of course, this is the first ministers' meeting. It's supposed to be around health. I know you'll discuss other things, but the premiers, as you know, want to talk about an increase to the health transfer. I know your government has said that there are billions of dollars going to the provinces right now, but that is all, as you know, sort of one-time cost to help them through the pandemic. Will there be a real conversation about increasing health transfers, or do you think that's for a later date?
So, Rosemary, we have said for many months now, the Prime Minister has been clear on a number of phone calls I've been on with him and premiers that we're more than happy to have a conversation around the long-term sustainability of public health care in Canada. It's a priority that we share with every province and territory, obviously. So that conversation will begin this Thursday. We've also said to premiers that Canadians properly expect their governments to be focused on the very urgent, real needs of the pandemic of COVID-19. We're in the middle of a very difficult and tough second wave. We had some rather distressing case counts in the last number of days. So they want the continued focus from our perspective to be on the healthcare system and the support Canadians need for the pandemic. But of course, the long-term sustainability of public health care is something that we're very happy to talk to provinces about. You correctly noted, Rosemary, we've transferred already $24 billion just this year alone to provinces and territories around COVID-19 response. But we're wide open to having what we hope will be a very positive conversation on the long-term sustainability issue.
Wide open is one thing, but is it an urgent conversation?
We think the urgent conversation, and we've said this consistently, Rosemary, is to work with provinces and territories on fighting the pandemic. Obviously, the vaccine rollout will be a critical part of long-term sustainable public health care in Canada. But we recognize that the provinces have, for a number of months, been asking the Government of Canada to have this conversation. We're happy to have this conversation, but we think it necessarily must also focus on the very real needs of continuing to fight COVID-19.
In 30 seconds, Minister, and I'm sorry I'm running out of time, you as Canadians may know, you beat a rare form of blood cancer not too long ago. You still have a very compromised immune system yourself. I'm wondering, does that mean that you will be part of the priority list? Are you anxious to get the vaccine yourself?
So, Rosemary, you're right. I had an allo transplant, a stem cell transplant from an unrelated donor just a little less than a year and a half ago. I was in Montreal a few weeks ago to talk to the doctors who did the transplant for me. And I asked them, I said, with my immune system and anybody else who's been through a similar process to me, what does that mean in terms of COVID-19? And they said to me that I would be considered immunocompromised. Right. But obviously, the scientific priority list speaks to people who are older than I am and frontline healthcare workers. So I'll be somewhere in the decision pack probably after those two other groups.
Okay. Minister, good of you to make the time this Sunday. Appreciate it.
Well, Rosemary, thank you for having me on your program.